reassurance. It's not necessarily about love. So when a parent asks when a child asks a parent for the 50th time whether they love them that day, it is not about love. It's about their anxiety. And that's super hard for parents to recognize. It's it's hard for us as caregivers. So what we want to do when they ask for reassurance are say things like, if they're like, Dr. Eakin, when am I going to discharge? I don't know. What have we talked about, or what have our previous conversations been about, or what do you think? When do you think you might be ready to go home? So you really want to put it back on them if you can and see if they can kind of problem solve. Because these kids are, they're smart. They can do it. You want to limit the number of worry questions. Sometimes we have to break it down per day or per hour. So we'll literally say, okay, today you get one worry question in the morning and you get one in the evening. Obviously, that's not where we usually start out. They need more than that in the beginning, and you sort of taper it away. You also can do something called delaying reassurance. So we do things like they have a request form. So if they have a question for me or their therapist, they write it down, they rate how anxious they are, and then they say how long they can wait until they can get the answer. So some things may be 5 minutes, some things may be 5 hours. So we want to, number one, try to get them involved in the process, but also sometimes you have to set the predetermined length of time before you'll give them the reassurance. You can use a positive reinforcement system or negative reinforcement, where either they have to give up coins to you when they ask reassurance, or you give them coins when they actually resist and they let you know. You also want to talk to them, especially adults can really see this, about cost-benefit analysis. What long-term gain are you going to get out of me answering this question versus the short-term gain? Because in the short term, you're going to feel better for about 2 minutes. But in 2 minutes, you're going to have the same question. So really, if we delay that, we're improving your outcome. And then you want to practice responding to reassurance with other people. So, number one, we police each other on the Child Center even. So, despite this being what we do every day, I still get caught. I'll be like, oh, they just got me. Or Aaron will be like, you totally just gave reassurance and I didn't realize it. So, and then we'll talk about, okay, with particularly difficult kids, how are we going to all respond? So we'll work together on role modeling some responses to each other. Again, maximizing treatment too. You got to have some rewards, whether you're an adult or a child. Rewards go a long way. These are obviously geared towards kids. So we certainly say, let's reward them for the effort that they're giving in treatment. It can be things like stickers, playing games, TV time, hanging out with playing a game with a staff member. On residential, we have the ability to do, and in IOPs with families, they can do larger rewards at the end of each week if they've done their work. And then really, you got to get super excited when these kids or adults, and again, it needs to be age appropriate, but on the Child Center, because we have little ones, if they touch a doorknob that they haven't been able to touch for 3 weeks, I do a cartwheel. We just do whatever a little kid loves that kind of stuff. So we just got to get really excited about their successes. And then we also want to model appropriate behaviors ourselves. So if we have predispositions on our own, I think it's important that we recognize it if we tend to have anxieties. So like for me, even though I'm a doctor, I don't want to wash my hands necessarily in front of them all of the time, especially for a kid who's on a hand washing ban in the beginning, because that might be triggering. So I may go somewhere else to do it so that they're not seeing those things. So we just have to be mindful of our own behaviors in front of them. And I'm going to end with a case study, and then you'll be free to go. So MT is a 12-year-old girl with contamination OCD who presented for residential treatment due to her inability to function at school or home. Her contamination fears focus on germs and unethical items. So her major sources of contamination included schools, bathrooms, McDonald's, and airports. And rituals took up to 8 hours a day, included hand washing, showering, avoiding places, and wearing what they called protection clothing, which would mean like long sleeves, pants, and maybe even things to cover their neck or head. They changed their diet to vegetarian because they were concerned about not being green enough. They were avoidant of leaving home due to concern about contamination. They would not touch their family members if they felt they were contaminated. The father actually flew for work and would have to decontaminate himself according to that child's protocol prior to touching her. His briefcase was not allowed in the home because it had been in the airport, and they avoided going to school. I already have that, due to germs. So, So to address their contamination fears, we did a variety of things. we did a hand washing ban. Then they had to contact increasingly contaminated objects, so it might be low traffic doorknobs to medium traffic to high traffic. It might include sitting on the bathroom floor. We do, when it comes to OCD, you do crazy things too. You eat off toilet seats. We did that. And then she had to also contact people who were contaminated. So maybe I'd sneeze in my hand, and then she'd have to shake hands with me. The sister was really contaminated, so we did a lot of imaginal exposures in the beginning where they thought about touching the sister. And then when they come to visit, then we can work on things. We use a lot of pictures, so sister sitting on the patient's bed at home. And then to address their fears of the airport and McDonald's, we looked at pictures of airport and McDonald's. We drove by an airport and McDonald's. We went to the airport and McDonald's, went through the drive-thru at McDonald's and smelled French fries, ate at McDonald's in an airport, touched the father's briefcase, touched their socks that went through security. Oops, hold on. And then we made a contamination cloth. And I bring this up because I think this is something that can happen on a lot of units too if you're working with someone with OCD, if they have a hand washing ban. So you make what we call a contamination cloth that's touched a variety of contaminated things. And if they choose to wash their hands to give into their ritual, then they have to recontaminate with the cloth. So I'm just trying to show you how creative you have to get to. So there's a McDonald's in an airport. Dr. Jacoby and I were actually flying to IOCDF, so we did this. And so the woman thought I was crazy, but I was, can I put this cloth on your counter here at McDonald's in the airport? And we had to take pictures and so to have evidence that we were really doing this. We put the cloth in with the French fries, so it smelled like McDonald's. I ate them to contaminate myself. So that's just to give you a representation of the kind of things that you need to do. These are really good websites for you to go to. AnxietyBC.com. I actually put, Joy Lynn was nice enough to run these up here to me. How to tolerate uncertainty and how to address reassurance seeking. I just have them as examples here. They're free on their website. They're really, really good and an excellent resource. So if you guys have questions, I know I'm out of time, but I'm happy to stay here and field some.